Hello, and welcome to School Health Presents Understanding the American Rescue Plan, ESSER, and Current Funding. I'm Dr. Ray Height, and I'll be taking you through this series of videos just talking a little bit about the funding. We've had a lot of districts reach out to us really confused about still what's eligible for these funds and what is not eligible. We've gone through several phases of funding up to this point, so we wanted to make sure that we supported you as best we could. When we're taking a look at the various types of funds, we want to remember a couple of things. So all of this started with the CARES Act. Now, many of you are saying, well, wait a minute, aren't the CARES Act funds done? And the reality is that first phase of CARES Act funding is complete. You are absolutely correct with that. But what happens sometimes, especially when it's come to funding and people's general understanding of the funding, is we start throwing these names around and we haven't really gotten clear points as to what involves the funding in each of those areas. So the true CARES Act, that first release of funding, was very specific in what it allowed us to do. And the focus was on the health of individuals, making sure we had things like masks, PPE of all types, disinfectants, hand sanitizers, things that were going to help our students come back into the classroom. Then as more funds were added, we talked about the SRSA funds. So those were the additional funds that were added so that we could expand upon this, but also start looking at what were those activities going on within the school days that needed to be augmented because of what had happened when we had to go into a virtual setting. So as we're taking a look at some of the areas of funding, I wanted to point out some things that are still going to be consistent when it comes to funding, current funding, when we talk American Rescue Plan and ESSER funds. So some of the things that, again, we've already discussed: PPE, disinfectants. Also, you want to be aware of indoor air quality and ventilation. So what are those air purifiers that are getting in there? Improving school facilities to reduce the risk of virus transmission and environmental health hazards. We're going to talk in a subsequent video about how that can relate to emergency preparedness too. Educational technology, including assistive technology, mental health services, which is so important in this day and age, but also those health protocols and how we stay aligned with that as we move forward. So one of the things when we're reading, and I know people say, well, what's the difference between the American Rescue Plan and ESSER funds? Well, let me tell you, they're the same thing, except the American Rescue Plan actually is the broad governing document. ESSER focuses in from Section 2001 onwards a little ways within that plan. So what we've got here is a little over $122 billion available until the end of September of 2023. That, of course, is passed on to the states and then down to the particular districts, so your funding may vary. But that can be used in so many different ways. And what you want to do is understand what liberties you can take and what liberties you can't take. We know that for a fact there have been some districts that have been questioned about their use of the original CARES Act funds as they went into play. I've spoken with a couple of government attorneys, and what they always recommend is err on the side of caution, but also err on the side of the student. And really, if you keep those two things in mind, you really can't go wrong with what we're trying to do. So what are some of the officially listed uses of the funds? Well, things like ESEA, IDEA, the Adult Ed and Family Literacy Act, and the Perkins Career and Tech Act. So one of the things you want to be aware of, going back to the ESEA, that was put forth by President Johnson. So when you're thinking about types of products that can go along with some of these fundings, you're talking about professional development, instructional aids, resources, parental involvement. So any programs that you might get those parents involved, pamphlets that deal with health, reading types of curricula, exercise curricula that actually help with the fitness level and the daily health activities of our students, and things like school nurse manuals. Those are all good uses of the funds. Also, you want to recognize that when we're dealing with populations where we're dealing with homeless children and youth, or those who are from socially social economically disadvantaged areas, there is a lot of funding that's available for them and some of the programs too. And take a look at things like PE activities, vision and hearing screening, technology for learning activities as a whole, and Head Start programs. So the subsequent videos, purchasing, I want you to understand that it will make sense for you to watch over these other videos. They're not going to be that long, about 3 to 5 minutes in length. Curriculum directors, health services and nurses, special ed directors, health PE coordinators, tech coordinators, athletics, emergency preparedness in all areas, facilities managers, higher ed, and non-public institutions. They will be videos that actually go in, give you ideas about what you can be using these funds for, along with being quite specific about what the act itself says so that you have reference to go back. So I'm excited to be bringing this video series to you. Please feel free to reach out to your school health representative if you have any further questions as we go through this.